Buenos días.
Good morning. My name is Rodrigo Martinez. I'm an IT engineer, and today I will tell you about health with a little bit of technology. I had a hard time explaining at home what the presentation was going to be about. Of course, we have to explain the whole leitmotif of this whole event, talking about recipes, cooking, and doing things in such a way that we can meet our goal. Also, through cooking and recipes, I was able to explain to someone who doesn't work in this area what a project is about. When we talk about something that begins and ends, that has ingredients, resources that might be cooked in slow motion or that can be burnt. But I will tell you about one recipe that was successful for us, just to put a little bit of context.
Los comensales son empresas de salud.
We work with health companies, and we have been providing development, infrastructure, project management services to some leading companies in the Uruguayan market. Companies that are providing assistance in Montevideo, Canelones, and Maldonado areas that have many active offices that assist thousands of people in Uruguay. These are companies that needed us to carry out this project because they wanted to have some sort of gourmet plate. They wanted to have be able to have their clinical histories in a digital way. And thankfully, they had their strategic goals clear, which is something that is so good for us. When someone tells you, well, I want to eat this and I want to have this, that's great because sometimes you can suggest side things. But the main thing here was that they wanted to have state-of-the-art electronic clinical histories.
Cuando se van a emprender proyectos, ¿qué es la gobernanza? ¿Qué es la gobernanza?
Something that's also very important is governance. That is to say, to have a strong decision-making power in order to carry out this project, to include it in strategic plans for the future, because without that, we know that projects do not move on. But of course, they lacked experience in terms of technology projects. There was no structure, there were no processes. They were lacking people who were able to do that and to undertake this. Of course, before we started cooking, at least I do this. Wouldn't it be easier to call someone and have this delivered to us? You might call somewhere, have the food delivered to us. It might not always be hot, but most of the times it tastes good. So we did this process. Before we started developing, we analyzed this process. We tried to analyze whether someone could deliver this project ready-made to us. What we found was that there was a reduced supply in terms of health software. And this supply was not very specialized in terms of the management change, of the change management. So we saw that that was missing. We also saw that much of the software was based on outdated paradigms. So they ended up being some notes where the doctor would record data, and ultimately they were useless. In terms of the reduced supply, we had to look for one of those delivery guys in Misiones, Argentina. We were having problems with our national airline, Pluna, so we couldn't fly there very easily. So when we got there, we found that there was no one in the market that could offer this plate, this recipe that we wanted. Something else that we saw was that there was a lack of flexibility from those providers in terms of trying to accommodate to regulatory changes. And there's also the culture of each institution. Sometimes they come to us, they say, we want this package, and when we try to change something, new problems appear. So we said, let's start cooking. How much time do we have? The time that we had then allowed us to have this, to just have these cold cuts, salami, but it was kind of complicated to get to a more elaborate gourmet plate that we showed at the beginning. So we had to handle some restrictions, which is something essential. And I'm talking about that triangle in terms of project management. We have reach, time, and cost. We can start bending that, but we cannot break it, because if we force one of the sides of that triangle, then something might break. And this is important because we need to take this to those leading this project from a medical and strategical point of view. We said, well, we can do so and so, but it might be more expensive or not, because if they know the different parts of this triangle, they will be able to accompany it. Something positive in our experience was to have a master plan. We took the methodology of our main project, we had a master plan, we will manage time, cost, etc. We will have a serious project done. Of course, when I talked about our master plan, people told me, okay, you will have it ready in 1 week. But it took us a little bit more than 1 month. But when we had it ready, we knew where we were heading and how we would arrive to that place. And that was essential for us. Also, something very important is to have tools that allow us to build prototypes. One of the reasons why we chose GeneXus is because of that, because we wanted to be able to quickly show something on an operational point of view so that our clients would continue to support the project. Something that was very positive in this project was that we could encapsulate it. We said, let's isolate it, let's get it out from the IT area. Why? Because the development area lives on the day-to-day activities in health companies, because they need to make changes at an administrative level, at a partner level, etc. So to implement such a project would have become very chaotic. So we created the so-called Manhattan project directors. This was the project that was built in the Second World War to build the atomic bomb. So we call this Manhattan Project. I don't know whether it is because we built an atomic bomb or maybe because we remind them of that. Besides from this, we need to make a partnership with them in order to analyze interfaces with an administrative level that are in the company. You cannot build a clinical system without losing sight of the administrative layer. It needs to be very close. You need to think about standard interfaces, to think about industry standards, S7, etc., without losing sight from that. And we always find in health companies that there's a lot of knowledge that hasn't been tapped because they live on the day-to-day activities. So you have to find which that secret ingredient is, because they also know how to cook. Well, together with this team, this development team that was already existing, we had to create a high-endurance team. And we were trying to find efficient profiles with a lot of experience that could provide quick deliverables in order to get to the client very fast. Here we have a monkey, because monkeys are always cheaper, but in the end they will give us problems. So we tried to find high-endurance teams, high-performance teams. Something that was very positive was to get professionals involved in the design of the system. Well, you might think, well, doctors designing graphic interfaces. Well, it was very positive. In these 2 years, I had to work with a doctor side by side, and this was very positive. We had a board in our office, and we spent hours designing things, and we tried to find ideas in order to get this project going in a good way. Also, you need to think about people for functional stress and loading testing. This is not just about development.
Piensen en esos perfiles. Este sistema tiene que...
This is a critical system because health is a critical system. But besides, when we were showing these things to doctors, they always asked, will this be running okay? Won't this crash? Will we be able to do this fast? Because that's what they wanted. So you need to invest on this as well. Once you have the ingredients, you need to take the time to prepare your recipe. Sometimes you are too enthusiastic because you want to start generating code, but you need to take your time for generating development standards. That's also important. You need to know that whatever you're building is being built in such a way that when you want to resume with it in the future, you will be able to do so. You need to define a process for change management. This is not very... This is a bit rare in health companies because when they saw this, they wanted to add things, and while we're at it, of course, this is something that happens in every place. People want to add things while you're doing other things. But that's a problem. If you don't manage that in a proper way, then the triangle is broken. So you need to take your time, even though you might look as being too bureaucratic. Whenever I go to a meeting and people tell me, can we add this? Can we add this or that? And I say, of course. And then people say, okay, I know that this will cost me more, but this has to be done this way. Think about the after process of the system. Once this is running, what do you need for this to be maintained? You need to think about a software maintenance system. What about the kitchen? The kitchen needs to be neat. It needs to be a good kitchen in order. And by this, I mean everything relating to hardware and communications, which goes hand in hand to what we said before in terms of this running well and quickly. In terms of infrastructure, this needs to accompany the whole thing. We cannot have an excellent project and then have it on a server that has leaks or that has some malfunctions. You need to invest on that because there's a lot of money behind this. Money in terms of resources, hardware, communications, testing. You also need to think about information security. We're talking about clinical records, digital clinical records, sensitive information, diseases, consultations to other professionals, and data need to be protected besides from other invoicing data that also need to be protected. But this is very sensitive information, so you need to think about that. And also we have the help desk, both the technical and functional help desks. Sometimes we have a project and then there's no one who can support that from a functional point of view. We hired medical students in order to provide a functional support because we couldn't expect an IT staff to be able to get along well with a doctor when it came to solving a problem. And now getting to the presentation of this to doctors. This is not presented by IT people. Forget about having IT people presenting this to doctors. They won't buy this if you do that. And this is for several reasons. It's not because of a lack of respect They respect us, but they don't want us. First of all, because we have a difference with them and we do not save lives, whereas they do. And they always say that we speak in a very difficult way or strange way whenever we're talking about software. And here we're talking about professionals that tell about onychocryptosis when you have an ingrown nail. So this says a lot. So doctors need to be the ones who present this to other doctors in terms of change management. This does not mean that doctors are not easily convinced. They are used to change, actually, because in medicine, changes always happen. There are new treatments, new technology, so they're used to that. But these type of things generate, as in any business, sensations of displacement, of insecurity, when they have to face that instrument when they're seeing a patient. So the first thing they said is, I will have to see less patients because this will take up more time, or patients will be angry at me because I won't be able to look at their faces while I'm writing. So you need to work on that. You need to work with doctors, have them involved, and also other health professionals, nurses, etc., so that this becomes a success. It's essential that the software doesn't force a cultural change, because we cannot expect to change the way doctors work just by using this software. They have their own paper, they do whatever they want, they put stamps, they write, they don't write, they erase things. So the software shouldn't be the one to determine how doctors work. On the other hand, pretty much the opposite. It should be a tool that doctors have to work in whatever way they work. And also think about contingency plans. If the system crashes, or if the system doesn't work, if communications fail, or if the internet fails, of course doctors need to continue seeing patients. Today, we see that sometimes doctors become addicted to information, because this is what this system generates. It generates good information. And when they don't have this system anymore, they complain. Actually, they could continue to see their patients, and they could write everything down on a paper, then have it scanned and add it to a digital clinical record, which is what they did before. But these are things that need to be thought about, to have contingency plans when the software fails. Nowadays, we can say that in the menu we have, since February, an electronic clinical record. We are about to launch a second version this week, and we're also working on other assistance areas. This is a thought for the outgoing clinics, but we also have other projects for the emergency sector, for ambulances, home visits, etc. But we already have a product that can be used and scaled. Doctors have tested it. They feel comfortable with it. They like it. The other day, Nicolás Jodal told me in one of the events that we made for Universal Technologies Solutions. First, when he went to see the doctor, then doctors would say, well, I have this system that's always requiring more and more data. 15 days afterwards, he took his son, Nicolás's son, to see a doctor, and then the doctor was really happy. He said, this is so cool, I cannot live without this. I do everything faster whenever I have to see my patients. So this is an interoperable system. We work with standard documents. Luckily, there's a project between AGESIC and the Ministry of Public Health and other agencies that are working in this health program, which has the aim of dictating ways as to how things should be done and to establish standards in terms of seeing clinical data that are to be exchanged within different systems. We took all those references and we made an interoperable system, and we added the cherry on top of everything. And we added a terminology server, a medical terminology server that's a reference in the region. For that, we had the support of the Italian Hospital of Buenos Aires with Dr. Daniel Luna, who took us to this unknown world of medical terminology and different ways of calling things. The other day, the doctor that works with me, we used to say, we have discovered that there are 14 different ways of talking about high blood pressure. And this was not going to be helpful if we had so many ways of calling one thing. So we used this system so the doctor can write whatever he wants to write, and the system can detect those terms in order to put them inside different folders so that information can be reviewed automatically and statistics can be extracted, which is something that couldn't happen before when we had some sort of free text. And this is very important. Some keys regarding the hardcore points of this health project. The image is aligned with the proverb, if you want to peel an onion, you know that you will be crying. And the things that we want to tell you so that you don't have to cry are the so-called master table of people. It's another world. Of course, it's a data table where you have different data. But when Dr. Daniel Luna came from Buenos Aires and he said, how are you doing in terms of this? We said, we're doing okay. And he said, well, let's clean this whole project up. And it took us much longer than we expected. You will find that there is information that makes no sense here. You will find that children are identified with their mother's ID card, etc. Another headache was digitalizing and migrating data. We had some system, information in one system and other data on other systems. So we had to migrate the whole thing. This was a problem. You need to analyze this very well and with a lot of time. Another headache that we have is that we need to keep health professionals interested. Doctors, we're always talking about doctors, but they are professionals that if we don't show them nice things every day, then they get bored, and so you need to have them hooked. You need to find a way either through tips or new features that will generate interest so that they keep being enthusiastic about this on a daily basis. Today, after several months since May this year, when we implemented this system, our guests are happy. They like what we serve, they like what they eat, and they keep on choosing this. We have more than 600 doctors that are using this e-clinical records already, and we have more than 85% of consultations that are made electronically through our tool, and this is growing more and more. So if you've become hungry about this and you want to come through our restaurant, we are not a delivery place. This is our store, Universal Technological Solutions, and thank you very much.